this machine, we're able to put patients to sleep calmly, and then we can operate and wake the patient up when we finish. It's a modern machine with this monitor. We can monitor the patient's system, how well things are, the pulse, the BP, the concentration of oxygen in the patient's blood. All can be, it's ECG, the way the heart is working, all will appear here. Even while we're working, anybody around the theater will see. And if there's any problem, you can see, and there's also alarm. So two things will alert you if there's problem. The ears will hear, the eyes will see. This is what we call the laparoscopic tower. Instead of making big cuts on patients, you make small cuts that can just admit these instruments, and then you go in and perform your surgery, and you will not have direct contact hand on the patient's organs. You'll be seeing everything on the screen. Like I will show you. Everything will be on the screen. This is the main screen. We have additional screen. And so with this and what we call hand instruments, you can carry out appendix, removing of patient's gallbladder, whatever, even its kidney. You can cut or resect the bowel, intestine, and join it with this instrument. Just like you are seeing my fingers now, if I'm inside the patient's abdomen, all I'll be seeing of what is contained in the abdomen will be on the screen. And I will use these hand instruments to do whatever I want to do. The advantage of this is that big cuts means more injury, more trauma, and more pain, and which means patients takes longer time to recover freely and return back to work. But with this method of minimal access surgery, the cuts are so small, the pain is less. Cosmetic-wise, it is better. Sometimes you hardly can see the scar, and the patient will recover and leave the hospital within a day or two. But with this, 48 hours, at most 72 hours, the patient is out of hospital and can return back to work earlier. So there's great advantage. With the assistance of BOI, we're able to purchase this set. And since we did that, patients that will have referred to other centers where this type of surgery can be performed is being performed here now. If somebody were to go out to do it, they will go with a caregiver. The cost of transporting two people to and fro, maybe staying in a hotel, paying for surgery there, and all that, and follow up. You cannot, how many people can go out for follow up? But here, you do it, your people are around you, they come visit you. There's more awareness now by our fellow Nigerians that a lot of the treatments they receive outside can be received here in Nigeria. Not only in the area of surgery, but as a surgeon, I'll talk more of surgery. There's virtually no surgery. Even if it's brain surgery, heart surgery, open heart surgery, kidney problems, urinary tract, women problem, OBS and gynae ONG, all can be addressed here. Because all that is required is a setup like this and trained personnel. Outside this country is the same thing, there's no magic. Once you have this, you are good to go. You can carry out any treatment, any surgery.